there does not appear to be a reduction in COVID-19 activity levels.
A new year and new COVID data has medical experts warning COVID-19 should still be taken seriously. Manitoba's first COVID update of 2023 shows no new deaths between December 25th to 31st, but has added a backlog of 38 COVID deaths since the latest report 2 weeks ago. It also shows 134 new lab-confirmed cases of the virus, with 50 people admitted to hospital and 12 in the ICU between the 25th and 31st.
That's more than 20% of people who ended up being admitted to the hospital that ended up being ICU patients. So that's quite a high percentage of people that have severe illness and need enhanced support.
As cases mount in China, there are worries about what new variants could be heading to North America. Medical microbiologist Dr. Philip Lagasse-Weens says data available so far isn't painting a clear enough picture to reach any conclusions.
It doesn't sort of jive with the experience that we had in other countries. So we think we're missing a lot of data. And in particular, we are missing data on what variants are actually circulating in China, and those sequences are not as widely available as they could be.
A new variant is circulating and has been detected in Canada. It's known as XBB 1.5.
It's basically a crossover mutation between two Omicron strains that were circulating before, and it has a number of concerning changes to it. One of them is that it tends to be quite immune evasive, meaning that even in people who've been infected and have had vaccine, they are at risk of, or they appear to be at risk of being infected again.
Dr. Lagasse-Weens says XBB 1.5's traits suggest it will most likely replace the current coronavirus strains in the next few months, but says there isn't any preliminary data to suggest it's any more severe than Omicron. He says vaccination is still the best way to stay ahead of future mutations.
Maybe the next one is going to be emerging from BA5, which is in the vaccine, and then you'll find yourself better protected because you had that bivalent vaccine.
In Winnipeg, Mike Albanese, City News.